Okay, guys, I am really frustrated at this moment in time. So, the other day, well, early last week, this past week, I had sent an email to my surgical group because I didn't get the chance to talk to my surgeon and ask him, like, when I'm cleared to start swimming again, when I'm cleared to start kayaking again. So, I had sent a message to the clinical team, and apparently, the medical assistant that I spoke to reached out to the exercise physiologist who sent back a message saying that I can't swim or kayak until my incision sites are really well healed. And they're doing really well, but they do still have some of the glue on them because I'm not pulling it off. I don't want to pull it off and like disturb the skin underneath or have anything open up. So I'm being very careful with those incision sites. But the two things that he said I could do besides like go for a walk was using an exercise bike or going on the elliptical. I don't have an elliptical at home, but we do have two exercise bikes in the basement. And so today I decided while I'm at home, just because I was kind of in the sun all day yesterday, I wanted a break from the sun and it's very warm outside. And you can kind of see in this window here, it is very sunny. It's in the 80s today, and so I decided to go down to the basement and ride the exercise bike. So I don't remember if I had talked about this previously, like before I even started like doing the weight loss medications, I had a hip problem. I know I made a couple of videos talking about the hip problems where they were talking about potentially doing steroid injections and things in the hip. Well, that was this hip, the right hip. So when I went to get on the exercise bike downstairs, I couldn't even stay on the exercise bike for 3 minutes. And it's very frustrating because it's too hot to go for a walk right now. Um, and like when I get off work, I've been running around the clinic all day and I don't really have the energy to go for a walk, especially when it's so hot outside. So like I get quite a few steps in during work, so I feel like that is the equivalent of a walk. But I'm very frustrated that I couldn't even use the exercise bike for 3 minutes because my left hip hurts so bad. And like I wasn't going to continue to push myself because it hurt so bad to the point where even like standing up from the exercise bike was excruciating. And so I don't know if I need to go see my PCP now to talk about these hip problems that I'm having, or like if this is just a fluke. I don't really sleep on that side. I normally sleep on my right side. Occasionally I sleep on my left side, but most of the time I'm sleeping on my right side. So it's not because I was laying on it weirdly or anything like that. So I don't know what the problem is, but I had even brought my phone down there. I was getting ready to pull up, like, there's YouTube videos that are like walking through Disneyland or different places. And I was going to pull up one of those videos and just do like 15, 20 minutes on the bike just to get some sort of exercise in, since, like I said, it's too hot for me to go outside right now. And I really don't want to be in the sun because I was in the sun all day yesterday. So I'm just really frustrated because I feel the urge to get up and move and do things, but like all I've been doing is kind of walking back and forth in the house, like trying to get some sort of exercise because I can't use the exercise bike. And like even when I had the pain in my right hip, it was never to the extent that the pain was in my left hip just now, or like 20 minutes ago when I went to try to use the exercise bike. So that really frustrates me. So like I said, I don't know if I'm going to make an appointment to talk to my PCP about it or like attempt to do it again, like maybe do some hip stretching or something before I try to do that again. It's just very frustrating, like I said. So yeah, I don't know what I'm gonna do as far as exercise goes because that's what I was planning to do, was to um like you start using the exercise bike for, 10, 15, 20 minutes after work, because even if I did that, like it would be a little bit extra exercise on top of the exercise that I get at work, kind of going back and forth with patients and things like that. Because there's been quite a few patients over the last week while I was at work that I've had to walk from one end of the hospital down to the other so that they can get x-rays and things like that, walking back and forth to the lab to drop off samples. And so I don't know what's going on. It's just very frustrating because like right now I want to be more active. I know I need to be more active, and I can't because I don't know what to do. Like I don't have an elliptical. I wish I did, but I don't. And like I'm not, like I said, I don't want to injure my hip worse. I don't know why it's doing that though, because I've never had a problem with my left hip. It was always my right. And like I'm not really supposed to be taking medications right now that aren't prescribed by my surgeon's group, just because of like that's just what they told me. So I don't really know what to do. I may ask my PCP about it when I go back to work on Tuesday. I don't work tomorrow because I'm seeing the neurologist, but it's just frustrating. So if any of you guys have any ideas of other exercises I could do, like I had thought about doing like walking workouts on YouTube today, but it's hot and like the exercise bike is in the basement. So I figured, it's cooler in the basement already. So it'd be easy enough to just go down there and, like I said, put on one of those videos on my phone and just do whatever. Or even if I just watched TikTok videos or listened to my audiobook or something, I could do that. But I don't know. I'm just frustrated. So anyways, if you guys have any ideas for stretching out your hip or what you think I should do, let me know. And yeah, I will keep you guys updated. Hopefully I can fix this hip issue and start being more active because I want to, because I feel like it would help me start losing some more poundage a little bit quicker. So anyways, that is all I have for today's video. Frustrated.